Okay, so where can I get more coverage? How do we complement original Medicare A and B? There are really only two paths. As much material that arrives in our mailbox as we approach age 65 and beyond, we might think that there's 100 different decisions and paths we could go on, and they really only break down to two. Option one is you could add Part D prescription drug and a Medicare supplement to original Medicare. The most common plan is a Plan G. It basically backfills all of the gaps in original Medicare down to a $233 calendar year deductible for all of your healthcare services that is covered by Medicare. Option two is what we've seen emerge in the last 10 years, especially. They're on TV relentlessly. Every old football quarterback is running ads for them. And these are known as Part C plans, Medicare Advantage Part C. These are carriers that have a contract with the federal government to manage your care. And it combines Part A and Part B into one plan, and usually includes Part D embedded in the product. And it may also offer some additional benefits like vision, dental. We often see, hearing aids covered on some of these Advantage plans, over-the-counter medicines, gym membership reimbursements. It can be, I call them bells and whistles, but it expands what original Medicare would do, and even goes beyond what the Medicare supplement would do when coupled with a Part D. The main advantages to the supplement versus the advantage is the supplement, you can buy the gaps down to $233 for most people. Some people in the room born or aged in before January of 2020 might even have an F plan, covers 100%. And it's also accessible. Any doctor, any hospital, anywhere in the country that accepts Medicare. Medicare Advantage, some of the advantages there are those additional bells and whistles or services that are not covered by original Medicare. And it embeds a Part D. So those are the two paths. Everything in your mailbox, everything you see on TV is either a Medicare supplement with a Part D or a Medicare Advantage plan where a carrier has a contract with the federal government. You assign them as your managed care outfit, and they will manage your care and all of the claims that happen along the way. So here's a deeper dive into Part C, Medicare Advantage. It's another way to get your Medicare benefits. It's an alternative to original Medicare Parts A and B. You do, by the way, have to maintain Parts A and B when you sign up for an Advantage plan. Plan members are still in the Medicare program. Benefits are administered by the plan. Plans are offered by private insurance companies. Most plans offer built-in prescription drug coverage, and plans may offer additional benefits, as we indicated. So Medicare Advantage, all Medicare Advantage plans cover everything that Part A covers and all the benefits of Part B. The exception is hospice care, which is still covered by Part A. Most Medicare Advantage plan covers prescription drugs. They kind of beat this to death. There's all kinds of extra bells and whistles, dental exams, cleanings and x-rays, eye exams, eyeglasses, contact lenses, hearing tests and hearing aids, fitness programs, and gym memberships are often included in these Part C Advantage plans. These are plans that offer coordinated care through either a health maintenance organization, a PPO, which is often a broader national network, a point of service that is like an HMO, but with some out-of-network benefits for selected services, special needs plans, people on Medicaid, or some states offer chronic condition type of special needs plans for, say, cardiac patients or diabetics. We talked about dual special needs. Those are Medicare, Medicaid. And then some states offer private fee for service. Right now, New Hampshire does not have one because the network is so built out. It's pretty well represented in an HMO or a PPO. And then there are some medical savings account plans for select groups of people. Institutional plans for people who are in nursing homes, it's designed and targeted to offer specialized care for people at that stage of life. We talked about this. You must be enrolled in Part A and B. Can't be denied coverage based on current financial or health status, including pre-existing conditions. May be required to use provider and pharmacy networks. Coverage and costs vary by plan and may change each year. Annual limit on out-of-pocket. So one thing that's nice about the Advantage plan is it does take that unlimited liability. If you're only on original Medicare and you don't have a supplement, you have unlimited liability. And it may make sense to look at this because it's going to put a cap on the max out-of-pocket. And these plans start at zero cost in New Hampshire. May charge a monthly plan premium, may not. Must continue to pay Part B premium to Medicare. So you're still paying your IRMA if you have one, and you're still paying the Part B premium. Part D prescription drug coverage. There's two ways to get it. You can get a standalone Part D, or as we indicated, often these Advantage plans, Part C, embeds that Part D right into, we call it baking it in. Medicare Part D plans cover types of drugs most commonly prescribed by Medicare beneficiaries as determined by federal standards. Specific brand name and generic drugs are included in the formulary list. Commercially available vaccines not covered by Part B may be covered under Part D. So most of us are familiar with the tiering that has come about in the past 15 years or so for drugs, 20 years. Tier 1 drugs tend to be the cheapest generics. Tier 2, still generics often, but a little more expensive. Tier 3 is entry into either brand name drugs or some very expensive generic drugs. Tier 4 is a non-preferred drug. It's brand name, but it might be a more expensive drug that treats the same condition that a Tier 3 less expensive drug might offer. Tier 5, most of the drugs we see on TV are Tier 5. I say if you see an ad on TV, that drug is likely $3,000 a month or more, upwards to $12,000 a month. So those are Tier 5 drugs. Now, leave it to our legislators to make this a hot mess of legislation in terms of moving parts. There are 4 stages to every Part D plan, whether it's embedded in an Advantage or whether it's a standalone. You have your annual deductible. Then your stage 2 is the initial coverage stage, the first $4,430 in 2022. Some of you may have entered into what we call the donut hole or coverage gap, where you've gone beyond $4,430 and now you're cost sharing at 25% of the total cost of the drug for a period of time till you hit $7,050. It's called the true out-of-pocket cost, TROOP. And then if you exceed the $7,050, you move into stage 4 catastrophic till the end of the year. You're going to pay 5% or $3.85, $9.65 for a brand name, $3.85 for a generic, or 5%, whichever is greater once you hit catastrophic. Amount paid for prescriptions depends on the stage. The dollar amounts can change each year. Not all plans have a deductible. Many people never reach the coverage gap. Statistically, 87% of people never go beyond stage 2. So that's the good news. The coverage stage cycle starts over again January 1st. So in order to have a Part D prescription, you must be enrolled in Part A, Part B, or both. You may be required to use a pharmacy network. Coverage and costs vary by plan and may change each year. Part D, premium penalty for late enrollment unless you qualify for a special enrollment period. So that's the advantage side of the equation. We've already covered a lot of this supplement information. You'll recall the hallmark is any doctor, any hospital, anywhere in the country. You have 10 plans available labeled A to N, with G being probably the most common plan. I'm going to jump over that because in the interest of time, we've pretty much covered supplements in terms of any doctor, any hospital. It's portable. You can move from state to state and take it with you. And it mitigates cost or exposure out of pocket to as low as $233 per calendar year. I always say if you could have 2 hips replaced, fight cancer all year long, have a chronic illness like diabetes, seeing all urologists, your cardiologist, endocrinologist, and every other ologist, and the most you would pay is $233 out of pocket. So some of this is a bit repetitive, so I'm not going to read every line item with your permission, and we've covered a lot of these bullet points. But this is the chart of the various plans that are available out there. They're coded A to N. A couple things I'll note. We're not going to cover every little line item here. It's too overwhelming. But what I will say is these are standardized plans. Whether you buy it from Colonial Penn or Transamerica, Anthem Blue Cross Blue Shield, Harvard Pilgrim, a G is a G is a G, contractually mandated by CMS. A G is a certain contract. There is a big difference between the low and the high, though. One of the things we help is find value stories in the market. For example, at age 65, you can pay as a female $142 a month for a G, but you could also pay $348 for a G. And it's the very same contract, just a different carrier. So part of the job we do in working with you is to find value stories that emerge and find carriers that are bringing, not only quality, well-rated products, but also at a competitive price. So these are the supplements, all standardized. Doesn't matter which carrier you buy them from, same contract. So I think we've covered a lot of these. Sometimes these PowerPoint presentations can be incredibly redundant, but the highlights, of course, you must maintain Part A and B, and you must live in the state where the plan is offered. Once you buy it, though, you can move to any other state and it's portable.